Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and leadership. As always, broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 282nd episode, we have a great show with healthcare thought leader, technologist, and innovator, as well as a longtime friend joining us, Mr. Mike Mosquito. Welcome back to the show, my friend.
Thank you, Justin. Glad to be here. Glad to see you again in 2024.
Absolutely. Yeah. First of all, Happy New Year to you for sure.
Thank you very much. Thank you.
Actually, thank you. You were just on the air a couple of months ago, but I believe you're going to be a more frequent guest. We've talked about that when we met up at Health last fall. I think you're just you're a great voice for our industry. You've always been a long time good friend of mine, great energy, very insightful. And so I'm really excited about this. We're going to do a prediction show on what what we see for 2024, 2025. Obviously, we can't focus on one year because healthcare is always playing long ball. But yeah, let's talk about what we're seeing in the industry, where we're going to see evolutions, and then we'll go from there and see where it takes us. But before we dive in too deep, where are you calling in from, my friend?
Today I am actually in Atlanta, so no Delta, 0 flights abroad. So glad to be home this week.
Absolutely, get a lot more done. I had to travel last week, but I'm going to be planted here in Sarasota for a few weeks at least. So I'm really excited. But you had a good holiday and all that good stuff?
Very good holiday. Very good time with the family, good time with friends. Took some time to relax and recharge, getting ready for the new year.
Same here. Actually had a great holiday as well and recharge. And that's kind of actually where the thought of this show came from, because I just saw a lot of just kind of see how people wrapped up 2023, but then certainly what are we all looking at and what the directions that we're looking at for 2024. So, I'm very excited to reach out to you immediately. Actually, when I started to read some of this and put some of it together, I said, who do I want to do this show with? And you're, very top of mind. So, I couldn't be more excited. Some of the stuff that you sent me, we're incorporating into the show. And so let's just kind of, dive in. I think the first part, and I just released this last week, was just, and you and I talked about this a little bit late last year, was just the evolutions in care management. And specifically my biggest area and focus right now is around the chronic care management and also remote patient monitoring, but really how the federal government did a great job evolving some of the management codes for 2024 for the rural health clinics and the federally qualified health centers, but also just overall the explosive nature of the codes, but also the growth that we're going to see in 2024 around chronic care management in general. So that's one of my biggest thing. I've been working, in the industry quite a bit around this, not only to make sure they go get those codes out, but then also just with the different companies and obviously the practices and the health systems around getting ready for this. And this actually balances very well to where, I think your very first prediction, and I'll let you share that here in a moment, but I was most excited, when seeing what you were sending me around some of your thoughts for 2024, but then also how, in my gut, I really believe it's a tipping point for chronic care management, remote patient monitoring, and getting this majority of care providers treating their applicable patients with those types of models. It's really, truly value-based care. And, a lot of us have been working on value-based care for 20 years now, trying to create these models. But I'm so excited I finally feel a lot of care providers, a majority that have applicable patients, will dip their toe in value-based care. And we'll talk about that more as the show goes on. They'll dip their toe through chronic care management and remote patient monitoring. So very excited about that. But tell us about your first prediction for 2024 and beyond, and then kind of weave well into what I just mentioned.
Well, Justin, it's great that you've been spending some time over on chronic care management and looking at how it's morphed, one from the policy standpoint, but also how others are getting into it. And I can tell you from a standpoint of innovation and technology, we've COVID pushed telemedicine to the forefront, but I think there's a lot of work still to be done there. I think the innovative companies that have done well in telemedicine are now realizing how deep they can actually get into this region of care. And so I would say that one of those 2024 predictions and beyond will be that telemedicine and the enhanced telemedicine platforms will be integrating more AI. The Internet of Things for remote patient monitoring will become more prevalent in the home, on the person, in their daily life. Virtual consultations will be, while you're doing it at home now, you'll see more kiosks showing up for you to be able to walk into anytime, anywhere on demand. And so moving it even deeper into the home, devices now that are going to be taken into hospitals will now be moving to the home. So at Health this past year, I previewed some technology where you can actually monitor patients without touch, zero touch. And so those type devices where you have zero touch, high realization of value to the patient are going to be seen. They're going to be everywhere. There's no reason why they can't, because now you've removed the human element that has cost, that has error, and you're able to look at a patient's entire being, whether it's disease management, whether it's diabetes. You're able to see that patient in a different light, but without having them get in their car, scheduling appointments. You still get a higher level and quality of care for that patient. So I think that the advancements in telemedicine are nowhere near done. I think the innovations that will be seen for AI and telemonitoring will be advanced as we move forward in 2024. And by 2025, there'll be new platforms that will provide that enhanced telemedicine engagement model for clinics, hospitals, doctors, nurses, and the patient themselves.
I love it. I love it. And I couldn't agree more. I think this is the whole direction around value-based care. It sounds like a big, scary word to a lot of people. And I understand that it's, changing payment models, but I think arguably 80 to 90% of, care providers don't navigate, don't really participate in value-based care plans. And certainly the patients don't either. But I do believe what you just discussed around telemedicine and hospital at home, and then also just these are great evolutions. So this is, like I said, and you integrate that with the care management and with the remote patient monitoring, you are bringing all of this forward. These are very small steps that providers can make, that patients can make. And it really keeps, I think we've seen a lot of these proof points. Not only does it help them, with finances, I mean, certainly when the increased reimbursement for chronic care management and remote patient monitoring, but also these are value proven models. So you've got,
Yes.
and patients want them. And so we're continuing to keep the patient front and center. And so that's one of my next big pieces. And I want to talk about some of the resources behind that as well, because I love the community health workers that I'm starting to see, really grow and become center stage. And you mentioned the patient experience, but really seeing how patients are kept front and center here with lots of different types of strategies. So whether giving them better financial experiences, to pay bills, and we've got some close friends in the industry that do that very, very well. But I think, evolving the financial experience, influencing patient loyalty through that process, offering multiple payment plans. Also, again, these are all consumer type strategies. And so I think keeping the consumer front and center. And what I've seen across all the board here is it is everything we talk about, everything that I'm seeing evolving is still keeping the patient front and center. This was not a fad. Consumerism didn't just, suddenly pop up in 2012, 2014, 2016, and then go away. It's here today. It started way back then, even before that, but keeping consumerism front and center, keeping the patient-centric care as part of these care models and a part of these experiences, whether it's clinical, financial, administrative, it's exciting to see. So I really think that, seeing, those evolutions are going to be very big in 2024 and seeing the success to these patients. So what would you add to that, or what would you add behind that?
I would say that I am now having companies reach out to me that want to have that conversation of where do I see fit? How do their innovations or their emerging technologies fit within what I am seeing happening in healthcare systems? While at Health, I had a couple of CIOs actually approach me because I was doing on-floor interviews with a couple of companies. And so I feel like that, being a voice, being one of those conduits for technology and innovation in healthcare, I'm able to see some technology that's working, see where it's working, how it's working, and how it's applicable across not only community-based care, but in large health systems, and how it can help that patient population, one, get better educated about how their care can be managed without having to worry about transportation, without, certain levels of devices being in their homes. How do we lessen the burden? That's part of this as well. So while we talk about advancements in medicine, let's lessen the burden for what hardware is needed to
Absolutely.
put in that patient's hands for that care.
Absolutely. I couldn't. And yeah, we got to lessen the burden on the patients, and we got to lessen the burden on the providers. And so that actually brings up another point, something that I've been talking about for, predicting for 2024. We're going to see continued market consolidation.
Mhm.
Providers and health systems have point solution fatigue. We've been talking about that for a long time. These very large platforms are really important. They're hard, they're expensive to create, they're expensive to purchase. However, doctors can't keep bouncing between screens. They want an integrated workflow. Care providers, they deserve an integrated workflow instead of patients. But you really got to look at that. If you have a point solution in health IT, digital health, or in healthcare, you're going to need to find a way to fully integrate that into the care strategy of an organization, of a practice, of a provider, into the patient, or figure out how you sell that into somebody who is part of a larger platform. So be very cautious of point solution fatigue out there. I do see that as a continued focus. Just again, people are sick of it. They just can't manage it, and you really can't talk or sell your way around it for long. You can do it at a small scale, but you cannot scale a company with a point solution unless you've really created the ultimate widget, and that's very few and far between. 9 out of 10 companies will absolutely fail in that direction. So, do keep an eye on that for sure.
I agree. I agree. That's a very good prediction for 2024. And you can see the consolidation that's happening too, Justin. Companies are buying these point solutions to try to give them a a beefed up look of enablement and be able to provide more services. But again, if you're having to toggle between screens while under that umbrella,
Right.
what have you really done? You really
Right.
haven't solved anything.
Yeah.
So as I consult with others in the industry that ask me questions about their platforms, my first question is, well, what's your integration strategy? What's your point and click strategy for the providers? And then how do you manage that when you basically built Frankenstein and you're calling it a single point of care?
Oh man, you and I've been around so long that we know Frankenstein. We know
We
Frankenstein
definitely
healthcare IT.
do.
We've seen it through the decades.
We have. It usually comes in
Absolutely.
the form of a PowerPoint.
So true. So good, my friend. So the next area I know that we're very aligned on is precision medicine. So give me some of your thoughts, and then I'll layer mine on.
So I think that precision medicine, as we talk about advancements in genomics, coupled with AI algorithms, this is one of those predictions I think that's already happening
Yeah.
abroad. With the U.S. is going to be catching up to it, but I will tell you, over in the UK and other countries, genomics has been on the forefront of their healthcare focus for quite some time now. Even my days back in McKesson, I will tell you, we were working with folks over in Sweden on genomics and genomic mapping. And what will that look like now that we've layered AI over the top of this so we can actually gather more information on vast scales and be able to collect that data, facilitate the personalization of that data, and treatment plans behind it. So individuals that have a genetic makeup of X will be able to map to other genetic makeups and solve for therapeutic solutions
Yeah.
and better outcomes instead of being practiced on, they will be healed, right? So it's
Amen.
great that we practice medicine, but how about we heal some people along the way and minimize those adverse reactions that occur during practice? And so I think bringing those advancements in genomics and precision medicine, looking at those plans that facilitate the patient's needs on demand, will be one of those that we see. It'll move faster. It's going to move faster with AI, and you'll see some of that coming out over the near future from pharma. Big pharma starting to work on it already. You'll see some of it come up in their ads as we start talking about trials that will come your way. If you sign up for a trial, I think you'll start seeing more of this data move to the surface for some of those disease management plans that have been out for years, decades, and we haven't solved for them. I think that this is the time that we'll see that mapping and those algorithms help facilitate that care plan.
Yeah, I couldn't agree more. I think you nailed it with precision medicine and the opportunity there and what we have to look forward to. We've been practiced on, but it's time to heal for sure. And I think a lot of us have, I've naturally went into as a healthcare consumer and as a more educated healthcare consumer, I've actually been able to kind of get out in the front of that with my own personal healthcare to have my, the different type of sequence mapping and also just looking for different fits with my genetics for my care plan. So I've been in front of that probably for about 10 years now, or 8 years now. But I couldn't agree. And the cost is coming down. And what's really exciting is a lot of health IT and digital health is having this integrated into their platforms. So
They
that's
are.
something very exciting to look forward to. Certainly in 2024, but I would say as we go into 2025 and 2026, it's going to be a standard case for most health IT and digital health.
I think the 23andMe, Justin. Have you done the
I
23andMe
have,
with the
yes.
health?
Yep.
So as most have, I will tell you, a good portion of the world have gone into that database. And again, I don't want to give the government my genomic mapping. Well, trust me, it's not that hard for somebody to get it.
Right.
So as we talk about what does that look like for the population of the world, it looks like you can now be grouped into groups of care that have a genetic makeup for therapeutic outcomes that will benefit you. So
Yep.
now you can be alerted, hey, based on genetic makeup, here are predictions for you that can now be personalized, like you said, for your own care. You've already started taking advantage of this.
Absolutely. And I'll tell you, every single thing that I did with 23andMe, and they came back with predictions about, or they questions about basically my health and then my past and my current habits, 100% accurate. So it's been amazing to see. And everything they say, even nuances about my body structure or my thought processes and hair color and all that, it's perfect. It's all been exact. It's really, really neat to see, to actually run through those trials with them. Has been a eye-opening experience. So one other area I think is interesting. You brought up blockchain and healthcare, because I have not heard that in a while. I know that's one of the ones that you brought up to me. So talk about your thoughts there.
Cybersecurity, security in healthcare is still one of those. It's a very big black hole.
Mm-hmm.
And while everyone knows that one of the worst places for a cyber attack is within a hospital when you've got a patient on a table receiving care live in an operating room, and all of a sudden the records aren't available. I remember my first Sentinel event like it was yesterday, and I wish that it was avoidable, but technology is fallible. It's built by humans, and it's one of the things that can fail. And cyber introduces a different level of care that we have to manage to and care of the systems of the health data, of the privacy, the integrity, accessibility of those records that are needed on demand at any given time. So blockchain offers that next layer of security, known and unknown to the healthcare facility. That CISO now has another option to start evaluating. Blockchain offers the opportunity for us to look ahead at how do I secure my records for my patient? How do I ensure privacy of the facility and the patient and the physician? And how do I ensure that all of this technology and data that's in this bubble called blockchain can be managed with the platforms that we have today? Now, you can't rip and replace, right? So blockchain and the ability to migrate your data through blockchains is key to the adoption of a new cyber day, a new technology enhancement, a new security enhancement to health data management. Data is key. So how do you protect it? You can't just say username and password anymore. You just can't say simple two-factor authentication. These are things that have been broken time and time again within facilities, and they're above the fold on the USA Today, right? So what is the next level of security? I have a brother that works in government security, and this is what they're looking at. Government security is already taken on blockchain.
Right. Absolutely. Absolutely. And for those that may have tuned in a little late, my special guest today is Mike Mosquito. And as my audience knows, Mike is a long-standing industry technologist and innovator for emerging solutions. And always so great to have you on air, my friend. I completely agree with you with blockchain. I think it's obviously from a security standpoint, it's desperately needed. We are making progress. One of the areas that I wanted to also talk about and get your opinion is increased M&A. I think we had the relatively new, the value-based enterprise safe harbors. They came out actually in 2020, but now they're starting to pick up, more speed. I think we're going to see more interest in value-based arrangements between digital health companies, payers, and providers because of this value-based enterprise safe harbor. So something it's been building the steam, and I think we're going to see much more M&A activity in 2024. Any thoughts on that?
I think we will see that again around the safe harbors, the consolidation. Again, there were large players.
Mhm.
I think those large players they're scooping up as much tech as they can as we
They
move into
are.
24 with AI. I think AI is going to change the landscape of those large players today. And as we look forward to the provisions that take care of the patient, I think you'll find it becoming, as we talked about just a second ago, with precision medicine, it will become more personalized. I think we'll see most of this care moving down a level from where we see it today. I think these guys that are sucking down this tech, that
Mhm.
are moving into this area, are going to be able to enable better technology, better database, and better data around patient care.
Yep. Excellent. Totally agree. So let's talk about robotics and automation. I know that you sent that to me as well, and it's something that I've seen a little bit of, but tell me your thoughts there on for 2024.
Again, the Da Vinci robot has been around forever,
Hmm.
Justin.
Yes.
When you and I here in Georgia, I think the first Da Vinci robot was in use here in Georgia
Yes, it
with one of
was.
our doctors here,
Hmm.
who was performing patients. And I think those surgeries abroad they will grow. And I think you'll see while we have surgeries happening for doctors today, you'll see more automation in the surgery room. You'll see AI coming better into play with dispensing that care, and you'll see drug to drug interaction being taken over. It will be out of the hands of the person in the room, but will be managed based on the care model that the patient's under. And now that will be automated. So again, what task can we take off the table
Mm.
of human care and put into robotic care? That's dispensing, that's knowledge base, that's actual physical touch. How do we pull that off of the human plate and move it over to an area that's automated? And cost comes into play definitely. While there's an upfront cost to that robotic introduction, the long-term cost is I am not paying for human intervention to manage these care plans, to manage the care path for a patient moving in through a facility. And so repetitive tasks in healthcare facilities, those are gone.
Yep.
Improving precision around the care plans, that will be increased. So reducing the errors, that's paramount for robotics. It is how do I remove the human intervention using known information and data to provide better care, faster care, better recovery for the patient at hand.
It's excellent. And I think picking up on this to an extent where robotics will not step in, because I completely agree with you at the velocity. But I want to take a moment here before we kind of shift into our last segment around a prediction around community health workers. I really do believe they're going to become a pillar of the healthcare community. As value-based care increasingly becomes a priority for people, our community
Mhm.
health workers play a very pivotal role and bridging the gap between healthcare delivery and building the trust within the communities. We see that certainly with CCM. It's playing out. We need a lot of those resources. These are not, these are nurses, but a lot of the care plan and the care work that's out in the communities, these community health workers do fulfill that. And so it's significant. And if you can hear our voices, if you've got family members or friends and loved ones, they're looking for an area to move, go look into that area. That's going to be significant growth in 2024 and feed for many, many years beyond. I live in Sarasota, so we're in the front tip of that spear.
Mhm.
You cannot hire enough community health workers here. We need more. Florida, obviously, you can imagine because of our population, but that's just the tip of the spear. The whole country is moving this direction. So just think about that tremendous opportunity. If you're hearing my voice today and you want to understand about opportunity in the future of healthcare, that's a significant area for millions and millions of people. So that's something that we're going to need more of, immediately. But I see a big pickup in 2024. So.
I agree, Justin. As you've seen also in those underserved communities, how do
Mhm.
we get that care pushed to those communities? And
That's
you've
right.
got to have those community workers in place, and whether they're tied to the church or other areas that take care of their population. Our HIT day here in Georgia talked about those underserved communities and how we need more community care. How do we get to those communities? How do we serve those communities? How do we provide what's missing, which is a doctor, a nurse, community provider of health, and understand these areas are not known for bringing population of doctors to them. So
Right.
we've got to get healthcare to them. And we've got to be able to provide that through these mechanisms and these predictions that we're talking about today.
Mhm.
And it may be that in certain areas, we're going to have to find how to bridge that gap between human and technology, and how does it get funded?
Excellent. I love it. I think one more item for each of us before we wrap it up, about 40 seconds apiece or 35 seconds apiece, is around, my next thought is around behavioral health. We had so much great progress. I just got a call, my previous call with a behavioral health leader out there. The investment going in there from the federal government, although a lot of the new investments that are coming that already were launched January 1st of 2024, but also a lot of the products, the focus on behavioral and mental health is so inspiring. We called it, we saw this come, as a crest building from 2020 from the pandemic, and then certainly 2021, but now we're starting to see all the policies and solutions, innovations behind that. So real quickly, in about 30 seconds or less, what are your thoughts for another prediction or even on that?
I couldn't agree with you anymore. I met a young lady last year at a conference here in Georgia, and she has been a breath of fresh air to me because she's at the forefront of behavioral health. I've got a young lady that's on my communication staff, and they both work heavy in behavioral health. It is again, you hear about the community focused on the police addressing behavioral health in their communities, right? Yeah. Substance abuse in play. How do you understand someone if you haven't been trained on dealing with mental health issues, substance abuse and disorders? How do we take that knowledge base and spread it across the continuum of care for all of those that are in that care continuum that provide to patients, Absolutely. That educate those that are coming into the fold? Absolutely. Mental health is paramount.
Yep. All right, my friend. Love it. Thank you for the support. Great to have you on air, and thank you for taking time out of your busy schedule to join us. And thank you to everyone for joining us today. We are at time, but you can please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific for all your shows. And you can track me on Twitter at HRT Advisor and use the hashtag ThisJustinRadio so you can respond to your comments from the show. I look forward to seeing you soon. Thanks, everyone. Stay safe.